And Susan, did you want me to introduce myself? You want me to just get started?
No, I will. I'm just waiting for the
okay.
clock to hit the top of the hour, and then I'll kick it off for you.
Perfect. Sorry, I was just like, wait, am I supposed to start?
Yeah, no. We've got just a little bit of time.
Super. All right. Thank you.
All right. Well, hello and welcome, everybody. Happy Tuesday. Thank you for joining us for today's Zomedica-sponsored webinar. We are going to be talking about feline osteoarthritis and safe treatment options today. It's being presented by Dr. Leilani Alvarez. Dr. Alvarez is the Director of Integrative and Rehabilitative Medicine at the Animal Medical Center in New York City. She's a board-certified diplomat of the American College of Veterinary Sports Medicine and Rehabilitation and certified in veterinary acupuncture, canine rehabilitation, and advanced Chinese herbal medicine. Dr. Alvarez graduated with high honors from the University of Georgia College of Veterinary Medicine and completed her internship and residency at the Animal Medical Center. She's been practicing veterinary rehabilitation and integrative medicine for over a decade and leads one of only 5 traditional residency programs in canine sports medicine and rehabilitation. In addition to running a busy rehabilitation practice, Dr. Alvarez is a renowned national and international lecturer, research scientist, and accomplished author of peer-reviewed articles. She's the 2017 recipient of the prestigious John Sherman Award for Excellence in Veterinary Rehabilitation, and she's also fluent in Spanish. Her areas of expertise and research include joint supplements, geriatric rehabilitation, veterinary orthotics and prosthetics, as well as regenerative therapies. So without further ado, please join me as we welcome Dr. Leilani Alvarez today.
Thank you so much. Can everybody hear me okay?
Sounds great.
Fantastic. Thank you for joining me and all that intro. Hopefully it just tells you that I'm qualified to give this talk. I really enjoy speaking on feline osteoarthritis because I've been seeing these kitties for decades. And finally, I think with some really excellent publications and new medications, I think these cats are getting diagnosed finally, and we have some really good treatment options. So that's what we're going to be talking about today is not just how to recognize it, but how to diagnose it, treat it, and have good outcomes. As far as disclosures, I really, oops, my slide doesn't want to move here. Let's see, there we go. This is a sponsored lecture by Zomedica, and I serve on some advisor boards and consultants, but none of that should affect the content that you will hear today. What we're going to review today is the prevalence and risk factors for feline osteoarthritis. We're going to review how to diagnose feline OA. I think that's really the key in order to help these kitties is you have to be able to diagnose it. And then really we'll focus primarily on treatment options. We'll touch on pharmaceutical options, even injectables, nutraceutical supplements, environmental modifications, and rehab. All right, so I wanted to kick off with a little audience question, and you guys can type your answers into the Q&A. And Susan, if you don't mind, once you get some responses, let me know where the answers are at. But the question is, which of the following is not commonly associated with feline OA symptoms? Is it A, changes in eating habits, B, decreased grooming, C, eliminating outside the litter box, or D, lameness? So we'll give you guys a chance here to put your answers in, but which of these is not usually a symptom of feline OA?
We're seeing
so we're getting lots of.
Yep, seeing lameness is the top answer.
Yeah.
C, eliminating outside litter box is one. We have one for changes in eating habits as well.
Okay. All right. So most everybody is saying D, lameness. Congratulations. You guys have clearly already had some good education on feline OA, because that was the biggest thing that I think as practitioners, we would be looking for a lameness in a cat, but that's really rarely presents that way. So for the most part, feline OA presents as a behavioral or a lifestyle change in the cat. Now, so you guys, most of you knew that lameness is not a common symptom. And in fact, changes in eating habits, decreased grooming, decreased socialization, eliminating outside the litter box. Those are actually all very common symptoms of feline OA. But in knowing that those are common symptoms, could those symptoms, changes in eating habits, decreased grooming, eliminated outside the litter box, could those symptoms fit with other presentations that we see in cats, particularly older cats, like chronic kidney disease or cancer? Or how about even like stomatitis and periodontal disease, also very common in cats, particularly older cats, or even hyperthyroidism, IBDD, IBD, normal aging. So you can see why feline OA, I like to call the big pretender, because it can present like so many other common diseases that we see in cats. So I think that's what's really hard, is if a cat presents to us and they are less social, maybe they're not eating the same that they were before, they're eliminating outside the litter box. I mean, there's a whole laundry list of things it could be. And I don't think most people put lameness, I don't think most people put OA at the top of their differential when they see those things. So we really need to do a little bit of a workup to know whether it's OA or these other common diseases that we see in older kitties. This goes without saying, but of course, cats are not small dogs. And it's really important to remember that the workup for OA in a dog is quite different than it is in a cat. For one thing, you can't walk a cat to do a gait evaluation. That's just not going to happen. We already mentioned that cats rarely show lameness. The symptoms are often not recognized by the owners because they associate it either with normal aging, or they recognize the symptom and they get brought into the veterinarian for that symptom. Let's say it's that they're not grooming as well. And maybe we do some blood work and things look good and we're like, okay, it's nothing really. So it's hard to recognize symptoms, number one. And if they are recognized, we don't always necessarily associate that with a possible OA diagnosis. When you try to do an orthopedic exam, that can be very challenging in a cat because cats have what I like to call kitty minutes. And that means there's a limited amount of time that the cat will tolerate you touching them. And that's particularly true when they're sore in their joints. Your kitty minutes are even more reduced than they are for any normal cat as it is. I want to touch on epidemiology because I think this will help you in your diagnosis. Feline osteoarthritis is extremely common. So maybe OA should be at the top of our differential list for those symptoms that can present, that can be masked for other diseases, because the prevalence of appendicular OA in cats, and this is from, I pulled from 3 different studies, really well done studies that surveyed normal cats with no symptoms of OA, and on the lower range, cats that are, from 1 year to 12 years of age, on the low end, the prevalence is 61%, and on the higher end, it's 92%. So even in all aged populations, feline OA is ranging from 2/3 of the population all the way upwards of 90% of the population. So very, very, very common in cats. And like humans, this is different than in dogs, but like humans, age is positively associated with cats. And what that means is the older the cat is, the more common OA is going to be in the presentation. And here's some stats for you on that. So the main risk factor for OA in cats is, in fact, age. And again, I pulled from a few different studies here. And so the first study, which was by Godfrey in 2018, looked at cats and broke them up into different age groups. Cats less than 5 years of age, approximately 46% of them have OA. So I like to think of in big numbers, so 50%. So even though age is a risk factor for OA, so the older they are, the more common it is, we do see it in approximately 50% of cats that are less than 5 years of age. I find that shocking. Maybe you don't, but I do, because most people are not looking for OA in cats that are less than 5 years of age. Then when they're nearing 6 to 10 years of age, that number goes almost up to 90%, so 89%. If they're 11 to 15 years of age, now the prevalence is 91%. And in this study, cats that were 16 years and older, OA was present in 100% of the cats. So if a 15 or 16-year-old cat presents to your clinic, you can just bank on them having OA and you will probably be right. So I would say err on including OA as one of your differentials when a cat presents to you for whatever it is that's not right about them, because you will more likely be correct than not, even when they're younger. But certainly the older they get, the higher and higher the prevalence is. So again, a cat older than 15 years of age, almost 100% of them are expected to have OA. In another study where they surveyed, again, normal cats without any evidence of OA or symptoms, 90% of cats greater than 12 years of age had OA. And then in another study by Duncan LaSalle out of NC State, he surveyed 100 cats aged 1 to 20 years of age. The overall incidence of OA in those cats 1-year-old to 20 is 92%. 92% of cats. So again, very, very, very common. Now, I have another question that I want you to answer in my Q&A. So I just said the number one risk factor for cats is age for OA. What is the number risk factor in dogs for developing OA? So the question is, we're saying the number one risk factor in cats for developing OA is age. So the older the cat, the higher the risk. What is the number one risk factor in dogs for dogs developing OA?
Let's see, breed or size in dogs.
Okay.
Breed is one. Conformation, genetics.
Okay. I haven't heard the right answer yet.
Let's see, weight, size.
Weight. Okay.
And obesity is another one that came in.
Obesity, ding, ding, that's it. It's obesity. So it's not just the weight of the dog. I think we tend to recognize the symptoms more in larger breed dogs because when they're lame, it's more obvious. But we see OA just as much in younger dogs than we do older dogs. But the number one risk factor of OA in dogs is obesity. Obesity. Obese dogs develop arthritis. That is the number two risk factor in cats. So whereas in dogs, it is definitely obesity. And while it does get worse with age, that is not the number one risk factor in cats. And so just, again, be aware of that because your older kitties, especially the ones that have chronic renal disease, they're really skinny cats. And I think a lot of us used to think, oh, they don't have OA because they're not overweight. But again, remember your risk factors. In cats, number one risk factor is age. In dogs, it's obesity. Now, that doesn't mean that your obese cat is not at higher risk for OA. And what we see is that approximately 41% of cats that have OA are also going to be overweight or obese. So we do see those as comorbid conditions. So approximately 40% of cats that have OA are likely to also be obese or overweight. But again, as they get older, typically they're dealing with other diseases. And so you may not see them overweight. Definitely have it on your radar if the cat was overweight or obese when they were younger, and now they're presenting to you as an older cat. Again, those are the ones that I would say very likely, like, you know, greater than 90% of those cats are going to have OA. And certainly if they are overweight or obese, it worsens their clinical symptoms of OA. All right, what are the other risk factors? Trauma is definitely another risk factor, but this is only 13 to 25% of cases of cats with OA are trauma related. And then just like in dogs, definitely there are breed predispositions. And the top three would be Scottish Fold. They get osteochondrodysplasia. Maine Coons are known for getting hip dysplasia. So if you get a Maine Coon cat at any age, definitely inspect their hips. You might even want to get radiographs. And if they're older than 5 years of age, you might just start doing some preventative measures for OA. And your Burmese cats are at high risk for elbow OA. So those are some breed predispositions. Okay. So when you look radiographically, we see that in 90% of cats, again, just randomly sampled, we find evidence of osteoarthritis radiographically, whether or not they show symptoms or not. And regarding the appendicular skeleton. The most common joints where we expect to see OA in cats is the elbow and the hip, hip being number 1, elbow number 2, followed by stifle and tarsus. And then the other area where we do also see arthritic changes is in the thoracic spine. So again, if a cat presents to you and may not be the most obvious symptoms to you, if you're going to be taking x-rays, I would go for hip, elbow, stifle, tarsus, and maybe get your spine in there. So it's helpful to know where we tend to see it more, because it can maybe help you focus in your exam and if you're taking radiographs as well. What are some other features? We talked about these, which is that primarily what you're going to notice is behavioral and lifestyle changes. So when the owner is telling you that they are more grumpy, they don't like to be pet like they used to, or they don't even like, get on their lap, they don't want to be near a person or another pet that they used to be more social with, that's definitely a symptom. We already talked about inappropriate urination, decreased grooming. The other really, really big one, I would say from a mobility perspective, is that they're likely to jump less, or if they're still jumping, it's usually to a lower height. The other one that I'll include that I didn't put on the slide here is when they're walking up and down stairs, they tend to stop in between. So instead of going up the stairs all in one, in one go, they'll take a few steps and then stop, and then take a few more steps and stop. That is another common symptom of OA in cats. All right, moving along to diagnosis. Of course, it helps to know what those symptoms are, and that older cats are very likely to have it. But how do we diagnose it? Well, if you're going to be doing an exam, I highly, highly recommend that you pre-medicate these kitties. If they're very, very old, maybe you just want 50 milligrams of gabapentin, but for most cats, 100 milligrams. If they're painful in their joints, you will still be able to detect that despite the gabapentin on board. What we don't want is a very anxious, fractious, painful cat. That makes it exceedingly difficult to examine them. I would recommend choosing a very quiet room, definitely no barking dogs, and as stress-free as possible. You may want to put in some feel away, clean the room, make sure that there aren't smells from other animals that have been in there. And I personally recommend a one-person exam. Cats feel less threatened with that. And we know that if we have a fractious cat, you're not going to accomplish an exam anyway. So that kitty just needs to go home and then come back pre-medicated. Use a gentle, non-threatening approach. You're likely to get a more accurate exam that way. Also realize that while cats can demonstrate joint capsule thickening, effusion, crepitus, and decreased range of motion in their joints, it's going to be a whole lot less obvious comparatively to a canine exam. And then I just wanted to show you, this is actually a cat that presented to us that was very fractious. And I just wanted to show you my one-person exam here and how I go about it. So I start with some good chin rubs. You can see I'm by myself. I'm mobilizing the joints without pulling on the limb. So I just did full flexion and extension of all those joints in the forelimb. Another little chin rub. And then I'm moving back to the hind, getting the little toes there. I'm feeling in the knee. So I'm actually testing for an MPL there because this kitty had a history of that. And then notice I didn't do the hip because that can be more difficult to examine. And on this side, I went ahead and extended the hip. And then I'm feeling the spine. And finally, LS. And watch the kitty's reaction there. Wow. So this kitty tolerated everything really well until I got to the LS. So to me, this was a very accurate exam, and that the kitty was tolerating my exam well and let me know where it hurt. So that's really your aim. And I realized I never did extend the hip on the right side there. And that's because that was the side that there was a question that, the kitty was having some issues on. And we did later examine the hip on that side. But the key thing I just wanted to stress is try to do the exam by yourself. Do lots of chin rubs. You can hold under the jaw. I can show you again how I did that there so that you're still safe while you're doing that exam. And if the cat is becoming fractious, your kitty minutes are up and you just can't continue that exam any further. Yeah, see how I have my hand there under the chin? So you can use that strategy to still keep you safe. Okay. When you do take those radiographs, I just wanted to point out a few things that are different in looking at feline radiographs compared to canine radiographs when you're screening for OA. I would suggest that you start screening radiographs for cats that are more than 5 years of age. Again, we've talked about this high risk factor with age in osteoarthritis for cats. While we do see osteophyte formation, a really big thing that is different between cats and dogs is you're going to see osteochondromas, which are free mineralized bodies, or they can also be called free osseous cartilaginous bodies. So you can see it in this radiograph here, right on the caudal aspect here of that scapula near the greater tubercle. So that is, some people call it a big osteophyte, but it's actually an osteochondroma. You will also see bone sclerosis. You can see how bright that is in the distal aspect of the scapula. So both the sclerosis and the osteochondromas are very commonly seen in feline OA radiographically. And you can see actually here, when they opened up this joint, you can see those free mineralized bodies, and there's actually a few of them in that shoulder joint. Okay, this is a beautiful study that actually looked at the incidence of OA in different appendicular joints amongst different studies. This publication came out in JSAP 2018 by Godfrey, and then they looked at their study plus Clark, Godfrey 2008, LaSalle's, and Slingerland. So we're looking at all these different studies together and seeing what was the proportion of radiographically detected OA. And we see, again, hip and elbow being the most common. So in this study, it was 46% hip, 42% elbow, but in the LaSalle study, it was 65% hip and 35% in the elbow. And then you see that stifle and tarsus are coming up next up. So again, if you are radiographing, if you are examining a cat and you're not sure which joint it is, those are some good safe bets to take a look at both in your exam and potentially if you're taking x-rays. Okay, so here's a little case for you guys. 7-year-old female spayed domestic shorthair had an MPL repair at 1 year of age bilaterally. So you can see those pins on these x-rays. So the cat is presenting now at 7 years of age for investigation of bilateral pelvic limb lameness. The MPLs are both stable on palpation. And so they took these x-rays, and I just wonder if you guys want to put into your Q&A what you think is the cause of the problem. Can you detect radiographically where the pain might be occurring in this cat that's showing bilateral hind limb issues? Do you see evidence of OA? Is it in the knees? Is it in the spine? Is it in the hips?
Oops, they're saying hips, hip OA.
Hips, yeah, absolutely. So there you go. Do you guys see that big osteochondroma? So that is ginormous, and you can actually see it a little bit on the on the left side, on the right side as well. So on the left side is where that big osteochondroma is. It's highly unusual to find in a dog. And you can also see remodeling of the femoral head bilaterally. So yeah, absolutely. While this kitty had an MPL repair at 1 year of age, and I think a lot of people think, oh, the problem is in the knees. Actually, it is in the hips, which is, again, far more common in the cat than knee OA, which is where we tend to think about it in dogs. Okay, awesome. Other changes. We already talked about that subchondrosclerosis is very common. And when you're looking at elbow OA, you're going to see that at the ulnar trochlear notch. You're going to see that subchondrosclerosis right beneath that ulnar trochlear notch. You are also likely to see these osteochondromas in the elbow superimposed over the epiphyseal bone. And also you can see soft tissue mineralization that can be very common with elbow OA, particularly if they are advanced cases. Now, another thing that I want to point out, which again, you won't see in dogs, is the supinator sesamoid bone. This is normal in all cats. We do not see this in dogs. And while we tend to see it in normal elbows about 40% of the time, it is both larger and more mineralized in cats that have OA. So on the left side here, you can see that supinator bone with the arrow. So this kitty has OA in that elbow, and so that's why we're seeing that supinator sesamoid bone popping up a lot more. And then on the right side, you see how tiny it is there. So again, another difference here between cats and dogs. We can normally see the supinator sesamoid bone in about 40% of normal elbow joints in cats, but we expect it to be more obvious, larger, and more likely to be mineralized when there is OA in that elbow. All right, moving on to treatment options. I think a lot of us have been scared to use NSAIDs in cats, and rightly so. There is a much more narrow toxicity profile in cats as compared to dogs for NSAIDs. We know that NSAIDs are gold standard treatment for both canine and human osteoarthritis. Thankfully, now we have a lot of studies that have demonstrated that low dose NSAIDs can be safely used in cats with quite high efficacy as well. And you'll see statements both from the AAFP and also AHA advocating for the safe use of low dose NSAIDs. What's really important to remember if you're considering using an NSAID in a cat is that the toxicity is absolutely dose dependent, and also you should think about the patient that you're using it in. We're going to go over some studies here that will help you in your decision making. This information I pulled from a publication in the Journal of Feline Medicine and Surgery that was published in 2012 by Bennett. And it's a nice, again, compilation of a variety of different studies and doses for different NSAIDs. So the meloxicam dose that they're talking about here is 0.1 mg per kg on day 1 and then dropping to 0.05. But if you look on the right here, I summarized for you here some more recent studies that would advocate actually for a much lower dose. So both in Gowan, JVM 2011, and there was another study by Gowan in 2012, and then more recently, the Kukanich study in JFMS 2021, the safer dose for meloxicam is 0.02 mg per kg per day. So that is my recommended dosing, and that is what I have safely used in cats. And keep in mind that these studies looked at cats that had chronic renal disease, anywhere from IRIS stage 1 to 3. And you can still safely use NSAIDs in these kitties. I would highly recommend you still continue to monitor their renal values and their urines. But if the kitty cat is significantly affected by their OA, this should not negatively affect their renal function. And in fact, in one study, they looked at dosing these cats at the 0.02 mg per kg for 400 days. The cats that received meloxicam compared to the control cats actually had lower levels of azotemia compared to the control cats. So again, you don't have to nix the option of an NSAID in a cat that has chronic renal disease. Another study by King and Javen 2016 using Onsior at a dose of 1 to 2 mg per kg per day. The other options here, Ketofen and the Vetoquil product, I would not recommend using. I don't think they're really that readily available. So it's really a choice between meloxicam and Onsior. That study in King was a shorter term study. So that's why I prefer meloxicam, because we have more longer term safety data for that use of that 0.02 mg per kg per day dosing. Okay, what are some other drugs that we can use that have evidence? And I apologize, this slide's going to get a little bit busy, but I just want to pull out the really clinically relevant information for you guys. So gabapentin, and I think that's probably the most common drug that's prescribed for cats with OA. We do actually have 2 studies that have demonstrated efficacy using gabapentin to treat feline OA. And the dose there that I would recommend you use is 10 mg per kg BID. Tramadol. So we know that in dogs, it is not a synthetic opioid like it is in people. It works more like an SSRI in dogs, but tramadol works the same in cats as it does in people. They do make that O-desmosol metabolite. So tramadol is actually a very, very effective pain reliever in cats. And again, we have a couple studies backing that up. And the dose there would be 2 mg per kg BID. Keep in mind that tramadol is very, very bitter tasting. So the only way you'll be able to effectively give this to cats is to put it into an empty capsule so that the cat can't taste it. And it can make some cats dysphoric. So very, very effective pain reliever, but just make sure that you give it in a capsule and warn owners that it may cause some dysphoria. Amantadine, we have evidence on the canine side as well, but a really nice study that as a single agent, actually, amantadine can help cats with OA. And the dose there is 5 mg per kg once daily. That's from the Shipley study in 2020. So lots of options there. And then most recently, a lot of you, I'm sure, have heard about Solensia. So this is a felinized anti-nerve growth factor monoclonal antibody that has now been FDA approved for the treatment of OA in cats. This is actually based on a couple of studies. First, there was a pilot study, and then there are actually 2 studies. I'm just showing you one of them that were multi-center, large-scale studies involving almost 300 cats, where they compared the monoclonal antibody to saline and followed these cats out for 84 days. We found significant improvement in cats beginning as early as 28 days. And then at 56 days. So most of the time, if you guys are using Solensia, it's going to be that second injection that you're going to notice the biggest improvement usually. And no adverse effects were noted except some skin dermatitis issues. And those are usually cats that already had underlying like dermatitis or flea allergies or other allergies. But overall, at least in the FDA pivotal field trial, was found to be very safe. I have been using a lot of Solensia, so if you guys have questions about that, we can take those questions at the end. Just very, very briefly on platelet-rich plasma, I just want to let you know about the couple of studies that have been published on this in cats. So we have a study that looked at the Arthrex system and the companion CRP system. Both systems did decrease red blood cells and white blood cells, but they did not actually concentrate the platelets to the 2 to 5-fold increase, which is what we're typically looking for. The Arthrex system actually decreased in the platelet concentration by 3%. And then in the CRP, we actually saw a pretty big increase to 187%. However, in all samples, we saw approximately 40% of platelet aggregation. So it just makes you question how effective those platelets were anyway, because they were aggregated. And then in another study, so this is the Chun study. So that first study that I talked about, that was actually out of our institution here at the Animal Medical Center. John Ferrari did that study. And then the second study, which was published in Frontiers 2020, did show concentration of platelets with the CRP system of 2.5-fold increase from baseline, but we have no efficacy study. So currently, I'm personally not using PRP in cats. What about our nutraceuticals and supplements? The highest level of evidence, without question, is omega-3 fatty acids, and I would recommend this be supplied in the diet. That's going to be the most effective way to get a high dose of omega-3 fatty acids into your kitty, as opposed to giving a separate oral supplement. If you are going to use a separate oral supplement, my personal top choice is Antinol. That's a green lip mussel extract, and it's just 1 capsule once a day for the cat. Many cats actually will eat it. You can, of course, use just plain omega-3 fatty acids, but then you need to going to be using higher doses because they're not concentrates. Also UC2, that's undonatured collagen 2. The product is Flexidin. They did have a safety and palatability study. We just don't have an efficacy study. Elivet was also studied. That's a CBD product in cats, again, for its safety and palatability, but not yet an efficacy study on that. So these are safe treatment options. The only one that really shows the efficacy is going to be your green lip mussel and your omega-3 fatty acids. And then again, even though it's not the #1 risk factor, we do know, again, that approximately 40% of cats that are overweight are also going to have OA. And so weight management, of course, is really important. This is actually a really funny case. This cat's name was Skinny, and he was morbidly obese. and he did successfully lose weight. What's recommended in cats is a 1 to 2% weight loss per week. That's pretty similar as what we do in dogs. If you are doing close monitoring, you can even be more aggressive in cats with a 2% weight loss per week. You do need to be careful with hepatic lipidosis because we know if they mobilize fat too quickly, that can put them into liver failure. So just careful monitoring as you initiate that diet with weight checks every week and checking in blood work periodically as well. I do highly recommend for any obese patient that you choose a feline specific weight loss diet that's going to be safer and more effective than just strict calorie restriction. Those diets are going to be fortified with protein, so it's going to help to maintain that lean body mass while they're losing the fat. And they're usually fortified with fiber as well, so that they're more satiated and hopefully less grumpy about eating less. Moving on to my area of specialty, which is mobility. Of course, this is really the biggest problem with cats is a lot of them are sedentary. They're indoor only and they're not doing much. Cats are predators and they love to hunt for their food. So if it's possible, I do highly recommend that you make it a challenge for them to get their food. They make these cute little mice things where you can put kibble in it and then hide it around the household. And then the cat has to find it. So essentially they're hunting for their food. It's both a wonderful mental stimulation for the cat and of course physical as well. And I just wanted to show you a video of my own cat. It's a little bit overweight. I often will feed him at the top of the stairs to get him a little bit of exercise before he actually gets to the food. Notice how he's stopping in between, right? So that's a sign of OA. But just getting the cat to move before they get to their food is a really good strategy for these cats. So whatever that movement might be, any amount of movement is good. So don't just give them that free meal, make them work for their food because that's instinctual for them, is having to find their food. All right. Other really nice environmental modifications is remembering that cats are not just predators, they're also prey, which is why cats really like to be on higher surfaces. So if you only if you don't provide these surfaces for cats, they're going to feel more vulnerable to being preyed on. And so I really like these. I think they both look pretty modern and can be aesthetic. And cats can easily then move up to that windowsill without having to jump to the height of that. So just giving them steps on the wall to be able to get to that height that they want to be at. You can certainly also use ramps so that they can still get on the bed or the couch or again, the windowsill, but just decreasing the height so that they don't have to jump to the same heights to get to the area that they would like to be in. They have all sorts of different things out for litter boxes. So they have the really low and open boxes, far better than an enclosed box that has a big step that they have to get into. And even also ramps that can get them up to the litter box. I would try a couple of different approaches. Some cats are very particular about their toilet. And so you don't want to change that too much. So leave the option that they've had before and then introduce some other options and see if they like it. And then finally, believe it or not, you can rehab a cat. This was a patient with advanced OA and renal disease that used to come to rehab for swimming therapy. And the owners would describe him really energized after these swimming sessions. You can see we're getting some nice range of motion of the joints there. I'll play that for you again. This is definitely not every cat. Some cats will just spring out of the water onto your ceiling. If you try to introduce water. But other things that cats really respond to in rehabilitation is laser therapy, massage. We're going to talk about also shockwave therapy and Assisi loop because those are very well tolerated in cats as well. So extracorporeal shockwave therapy. These are high pressure, high velocity, but low frequency sound waves. So there's no heat generated from these. It's, you know, when there's a thunderstorm and you hear that big bang of the thunder and your windows reverberate, that reverberation is the shock wave that was generated from the sound wave of that thunder. So it's the same kind of energy. There's ample evidence in the veterinary literature for electrohydraulic shockwave. So not all shockwave devices are the same. So you do want to ask that question, is this electrohydraulic? Because the other devices on the market have no evidence for them. And we do have studies that have found that electrohydraulic extracorporeal shockwave therapy is safe for treating both stifle and elbow OA. And PulseVet now has a new extrode, which does not require any sedation, which is really, really nice for your feline patients. So over here on the left, this is the 15-year-old male neutered Persian kitty that presented for bilateral hip arthritis. That's what it sounds like. So it sounds pretty loud, but this kitty's awake. So that kitty was awake. Most actually are not bothered by the noise. The feeling that they have generally is going to be relaxing because they're going to get a big rush of endorphin release. And this kitty that was actually lame, I know we talked about how rare lameness is, but this kitty was actually lame. And after 2 treatments spaced 2 weeks apart, his lameness actually resolved and started jumping again. This other kitty here is a 2-year-old female spayed domestic short hair that presented for a shoulder injury and was not using that limb. And then after 3 treatments spaced 2 weeks apart, that lameness resolved as well. So you can see, again, kitty's awake. And awake and tolerating the treatment really well. And here's another patient, 11-year-old female spayed domestic short hair. I actually showed you the video of her exam. So this kitty actually had a history of mammary gland adenocarcinoma, and she'd actually had a radical left chain mastectomy. And presented to us for acute right hind lameness. So watch this video. This is a home video. So this is what we don't see in clinic, right? Like at home, she's limping. By the time she got to us, 2 months later, when she presented to us, she was no longer lame, but you can see how reluctant she is to move, and she is really lame on that right hand leg to the point where she's like, you know what? I don't even want to walk across that floor anymore. So what's your diagnosis for this kitty? It's an acute onset right hind lameness. We don't need to do the Q&A for this one. She did, in fact, have a cruciate tear, which we can see in cats. And you see, again, this osteochondroma. You see those mineralized bodies there. Again, this is more specific in cats, and that's usually actually associated with mineralized menisci, which is, again, something that we tend to see in cats a lot more than we would in a dog. So you can see it here blown up a little bit on the left side. Do you see those areas of mineralization? So we thought most likely those are mineralized meniscal ossicles in her stifle. So here she is 2 months after that acute lameness at home. And so we're trying to do, here's our gait evaluation. And you can see more than anything, she's really crouched in her gait. And remember that exam, she was really actually mostly painful in her lumbar spine. So it really wasn't her knee as much as her lumbar spine is where it actually localized to 2 months after the acute injury. So what's her plan? This kitty was actually undergoing chemotherapy, so I wasn't really excited about putting her on a non-steroidal. And she was very fractious, actually. Even though I did that exam with her, mom said, like, there's no way that I can give her a medication. So we weren't able to give oral medications to this cat. So what I did was actually transdermal gabapentin, which we do have a publication by Slovak. She was with us here at AMC. She's an internal medicine specialist, and she published a study in JVM 2020 showing efficacy of transdermal gabapentin at 10 mg per kg TID in the inner flap of the pinna. And then we dropped an Antanol capsule into her food, which she readily ate. We switched her to Hill's WD because she was a little bit on the heavy side. We did a lot of environmental modification to give her, again, ways that she could get to higher places without having to do that big jump. We also did the PulseVet shockwave therapy to her knee, and we also sent her home with the Assisi loop. And then here you can see her after treatment. You see how much better her posture is. Now she's extending those knees. She's walking a lot more erect. She's got a neutral spinal posture. So even though gait evaluation is very challenging in the cat, I think we can all agree that she was significantly improved after that treatment. And in fact, mom Oh, so this is the Assisi loop. So you can do either the loop to go home, or they actually make the carrier as well. And that way the kitty can just lay in the carrier and get the therapy. So very, very user-friendly for cats in particular. And then I just wanted to show you this video. So she had presented to us in the summer, and this is a video from last Christmas. Look at her recovery. She's just like playing and going up and down on her tree with no difficulty whatsoever. Look at that. So big change from the initial presentation. I don't know if you can see, but she is also a little bit skinnier.